You know, if we think about the way that we educate surgeons over time, if we think back, you know, it's clear that surgical education has evolved and has changed. And I put this picture in here because it's a very famous painting, and I love it because it shows the instructor, the fella on the left with the white coat, who's getting ready to operate, and you've got this room full of individuals who are clearly surgeons learning, getting educated, and you've got this amphitheater type setup, and these were really common. And I think this is a great picture, and you think about this, you've got your patient down there, you've got the surgeon learning, and you've got tiered seating where you'd have dozens, if not hundreds, of individuals who are learning surgery watching. And that was really the only way to do things in terms of having people view when you're doing surgery, trying to learn, the master surgeon describing what's going on. And that was really common for surgical education, you know, at the end of the 17th century, 18th century. That's how people were doing things. But as time has gone on, we have really evolved how we train, because we learned over time, as we began to understand antisepsis and infection control, the idea of having an operating theater with dozens or hundreds of people watching was not a great idea in terms of infection control. And so the operating room certainly changed, where it's a sterile environment, great lighting, great view of the patient, the anatomy, things that you need to do, but it didn't necessarily allow for a lot of individuals to watch what was happening. And you can have a few, you can have a few individuals in the operating room, but you can't really train a large number of individuals with that kind of setup. And so you can have a physical connection with the operating room, literally by hardwire, where you can expand the number of trainees, the number of individuals who are watching the surgeon perform his or her craft and talking about things. But hardwire connections are limited by proximity. And I've done some of these, and I'm sure, Steve, you have, and Neil, you have, and Mo as well, where you're operating and maybe in a auditorium a few feet down the hallway or another part of the building, you have a hardwire connection. And you can certainly do that, but it limits the number of individuals who can learn. We move into the situation that we have today, and live streaming can be used for education. As a matter of fact, we're doing live streaming today with the Baylor residents watching this. So what is live streaming? Well, it's where you broadcast real-time live video to an audience over the internet. All right, and initially efforts were made with this really back in the mid-90s, but things didn't work so well. The technology wasn't great. The amount of data that could be carried and the speed with which it could be carried was not really impressive, and so the video was poor quality, it was kind of choppy, there were audio sync issues. But as time has gone on, computing power has certainly increased, and the ability to carry a lot of data over the internet has made live streaming really pleasing, and it works really well. Okay, so a few terms. Streaming. So streaming is really where data, in this case we're talking about video and audio content. Data is sent as a continuous stream over the internet, and so it can be played as it arrives. So if you have a Netflix account or Vudu or Amazon Prime and you're watching movies, that's streaming. It's not live streaming, because the action taking place on your screen is not happening right then. It's streaming. It's where that information is sent to, and for most people's case, to the house, to the TV, or maybe to your smartphone, whatever, and you watch it as it comes in. So the information is continuous. You watch it as it comes in. That's streaming. Okay, so streaming is where this information arrives at the device. Again, that's either a TV, or it could be a laptop computer, or a desktop, or a handheld device. And then something called a decoder arranges that information and displays it so we can understand it. Because when the information is sent, as it's streamed, it's not like there if you're watching a movie. It's not like the images are coming over in the stream through the internet. Rather, it's data in the form of X's and O's or ones and zeros, however computer language works. That's what arrives. And so that's what streaming is. And it sounds really complex, but streaming is really going on all the time. If you think about this example. When a frog does what a frog does with the throat and it makes a sound, so it makes that, it does that. What is that? What happens? Well, it produces data, and the data is vibrations in the air. So the vibrations, it's not sound. Okay, it's not sound until it arrives at a decoder and then it's assembled. It's data, it's vibrations passing through a medium, in this case the air, and then the vibrations are reaching the device, which for us is us, our ear collects it. That's not sound, because we have to have a decoder arrange all of that information so we can understand it. In our case, our decoder is our brain. So the vibrations come through the air, our decoder, our brain, puts it into a form that we can understand, and that's when you have sound. So we hear the croak. Okay, so streaming is really common. It's happening right now. It's very, very common. It's nothing mystical, but we can certainly utilize it for education purposes. So we talked about streaming as data is being transported and then watched, but then live streaming is where the audio and the video are produced, they're streamed, they're collected and viewed all in real time, like we're doing for the Baylor residents. So this is all happening now and they're watching it now, but that's live streaming. All of this is happening in real time. And if you go onto a site like YouTube or Facebook, certainly they have streaming ability. For instance, on YouTube, my YouTube channel has 70 or so videos, surgical videos we've produced in the operating room, and then people can watch those. That's streaming. But now those sites are getting into live streaming, so YouTube Live or Facebook Live, where you can produce this content that's happening now and watched now. And so that's becoming more and more common in terms of using social media and the internet to reach individuals. And you can certainly do the same thing with surgery. There are a couple different vendors that do this. There's something called the AIS channel, Advances in Surgery. They're actually based out of Barcelona. And there's something called Broadcast Med. And these companies do live streaming from the operating room to use for surgical education. And so you think about this with telesurgery. So the internet is global, right? So live stream isn't limited by a space. So anybody has access to it as long as you're not in, and then of course there are some places, and what comes to mind of course is the People's Republic of China. I've operated there, been there, and things are certainly much more restricted. But in general, the internet is global. Live stream isn't limited by space, and so by using live stream, the classroom isn't any longer just a brick and mortar structure. It's not a physical construct. So educational events can be attended by anyone, anywhere in real time. And the educational event can be archived, which is really nice. So if Dr. Wilson does a live stream surgical event, individuals watch and they learn and they see, but let's say they think later, well, you know what, Steve said something about preventing crossover. What was that? They can go back and watch again because all these live stream events are archived. Or those individuals who couldn't watch the first time can go back and watch. So you have the live stream event that's happening real time, but then these are archived, and so they remain available for education. And during live streaming, attendees, those watching the live stream, they can, and trust me, they do, they participate directly with the surgeon instructor by typing questions. There can be a chat room, so they can ask questions, comments, and you can respond. So telesurgery, the virtual classroom, is really a powerful medium in which we can use to educate. So what I wanted to do was talk about some examples that I've had and some things that we've done with the virtual classroom. And this was a webinar that I did with my fellow just recently, just a few weeks ago. So we conducted a webinar in collaboration with Coloplast. And so I do a lot of and I'm sure many of you do, will do patient education talks, perhaps at your office, where you'll invite patients in and you'll talk about incontinence or some aspect of prosthetic urology. And the companies, the device companies will help promote those. And I find those really effective to educate patients. And I'm pretty happy if I can get 20 or 30 guys or 20 or 30 couples to come out, I'm pretty excited by that. Well, with this webinar that we did, which was streamed, was actually live streamed, it was real time, we had 123 individuals log on and watch this real time. There were questions that were submitted that we could respond to, and this was a great way to perform or to carry out an educational event. People could stay at home and watch. There was anonymity. They could ask their questions. They didn't have to worry about, who knows what I'm talking about. It was easy for me and my fellow. We just sat at my desk and we did it. But webinars are a way of using the virtual classroom to educate. So I mentioned before about YouTube and Facebook having their live streaming capacity. And so I did this, I put on a live streaming Facebook Live event. This was at the end of August. And it was a patient who the Peyronie's disease and ED, who we had done an implant. We treated his implant, and he really wanted to evangelize. He really wanted to spread the word and tell people, hey, listen, these things are available. Men need to know this. So we did a live stream event on Facebook, and we did it from my office. It lasted about 16 minutes, and this was at the end of August. And as of last week, when I was putting this talk together, it had over 5,000 views, which is amazing. So you have 5,000 individuals who have watched this patient say, listen, here's what I had. Here's my problem. Here's how we treated it. Here's how I'm happy. Here's how my wife is happy. And that's really powerful for education, for us to be able to reach patients, to reach men and women, and men and the individuals who love them, to tell them things that we can do in prosthetic urology that can help their life situation. So it's a powerful medium. And I've done, in terms of live surgery, we've done a couple of events. In April, we did an event from our operating room with the AIS channel. That's the company that's out of Barcelona. And this was an artificial urinary sphincter. And the way that AIS channel does this is they recorded the video. So they came and shot video. And on that day, April, the video was played. So the video was shot. It was minimally edited, actually not edited at all. The video was shot, and then it was played that day. And so that was streamed, but the live streaming component was we had individuals could interact, surgeons and viewers could interact and ask questions, and the questions were rolling in. As a matter of fact, my fellow last year, a Baylor resident, Chris Graziano, was kind of taking the questions, and I was doing another case, and the questions were just rolling in one after the other. It was very powerful. In May of this year, we did 2 actual live stream surgeries with Broadcast Med, a company that does this kind of thing. We did a AMS 700 penile implant, and then followed that up with a Titan penile implant, and that was the setup in the operating room they used. But this was true live streaming, so everything was live. Questions came in. We could answer questions during the surgery, and I did. We were speaking to the individuals, explaining what we were doing. It was beautiful video, beautiful view, but this was a true live stream event. When you look at these two events, the artificial sphincter surgery and then that day with the 2 implants, so the most recent metrics show that of those, there were 773 physicians who watched live as the event occurred. 98 other individuals who were non-physicians participated in this. So almost 800 physicians and then another 100 individuals were tuned in and were watching these things and were learning. It's fascinating to me. There were 33 countries represented by this. So these individuals came from 33 countries across the globe that were actually participating in this. And of course, there were questions submitted. Most of these individuals were from the US or from Western Europe, but not exclusively. We had individuals from all over the world were watching. And so live streaming surgery, the virtual classroom, live streaming educational events, surgery, things like we're doing today, I think are a really powerful way to expand our education as we're training physicians and surgeons. You know, what's the potential? Where can we go with this? And I know Mo can speak to this. The Sexual Medicine Society of North America, the SMSNA, we are now committed, and we're going to begin live streaming events. And there'll be educational webinars that are done where we will have experts in the field, people like Mo or people like Dr. Wilson, who will conduct webinars that residents, urology residents, fellows, practicing surgeons will be able to log on, and we'll have these live events. So that's something our society has committed itself to. I think live streaming surgery is something also we're certainly looking at and we're considering. But we need to embrace, and the SMSNA is absolutely going to embrace this technology, but I think this is technology that can be embraced really by any entity, which raises the question then, so can motivated surgeons or individuals embrace live stream technology? And hopefully you understand that the answer is absolutely yes. So this picture here is our setup that we use in the operating room to shoot surgical video, because we shoot a lot of surgical video, and this is all housed on my YouTube channel. So it's got an HD camera, it's got monitors so that I know who's the individual shooting the video, who is my circulating nurse, Judy, who is here today. She shoots the video and she does an amazing job. We have that bigger monitor on the left so I can see exactly what she's seeing. And this is the setup we've been using to produce surgical videos for several years now. On the bottom is what I'm using now for my live streaming events. And so my fellow and I, just a couple weeks ago, we did a live stream event on YouTube Live. So Brittany and I sat down. It was about a 30-minute talk, and the title of the talk is Maximizing Success During Men's Sexual Health Surgery. And so we use this particular setup to do that live streaming event. And so what the setup has is this. It's obviously got the camera. Good, you can see that. It's obviously got the camera. Brittany and I are sitting over here. So we've got the camera, we've got microphones, we have an audio recorder, and so the microphones feed into the audio recorder, which produces really high quality audio. The audio is then actually run back through the camera, because if you run your audio through the camera, there's no syncing problem. Sometimes when you're doing streaming events or live stream, if you don't run your audio through the camera, then there can be a little bit of a sync problem between what you're seeing and what you're hearing. We run it through the camera, and then all of this feeds, this high-def video and audio, come down to this little thing here. It's called an encoder that passes it on to the computer and the software. This is an Ethernet link up to the computer, and the computer has the software that allows the live streaming. This is an external hard drive. or right here is the hard drive, and what I have on that are video, surgical video. And so the point of all this integrates in. So what happens, you start the live stream. So Brittany and I started the live stream, and we were speaking to the audience, and individuals could ask questions, and they did. They were asking questions, and we could reply back to that. With this video hooked up, with the surgical videos integrated, we could seamlessly move from what we were saying to bring video in. And so we would talk, and we'd say, well, during penile implant surgery, we try to maximize length of the implant by doing oversizing, and we brought up a video that showed this. We talked about how with girth enhancement things you can do. So we could integrate the video with what we said, and again, the response was tremendous. So yes, live streaming can certainly be done by individuals. Our next step, and so Steve, I'm going to extend an invitation now. We want you to come for this. I'm going to extend an invitation. We're going to start doing live streaming from the operating room. And so Judy, get ready to start shooting this. We're going to be having live stream events from the operating room, live stream surgical events, and that's going to be the next step in terms of our ability to educate. And I think this will work very well. Now, you always have to be careful you don't have your scrub nurse want to get into the picture by sticking her face in like she did here, but it's possible to do these things, and individuals and motivated individuals, institutions can do it, and we should be embracing that. And so I think that the classroom is no longer physical. We don't have to educate just a few people at a time. We're educating here today in this classroom, but we're having residents watch as well. So the virtual classroom, I think, is a great way to educate. We do need to embrace this technology. Individuals can certainly do it, as can institutions, and I appreciate your attention this morning. Thank you very much.